So my message to everyone is healthy skin is not equivalent to fair skin. Although Indian skins have a natural sun protection because of the presence of melanin, because we are slightly darker.
Hello and welcome to BeyondSkin, a skin initiative by Derma in association with Derma Lab Private Limited, where we dive deep into the world of skincare trends and everything in between. I'm your host Shruti, and in today's episode, we'll learn about something that we all want: how to take care of your skin in the best and healthiest way possible. To help us cut through the noise and build a very solid foundation, we have Dr. Shital Poojary with us. Dr. Shital does not only have 2 decades of experience as a dermatologist, but she is also a professor at KJ Somaiya College. With her expertise, today we'll learn the best way to take care of your skin. Hi ma'am, how are you today?
I'm good.
I'm very excited to have you for this episode. With your expertise, I just want to know what actually is defined as a healthy skin from a dermatology point of view.
Yeah. A healthy skin basically is a blemish-free skin, a spotless skin. So perfectly healthy skin should be blemishless, spotless, and without any eruptions on the face.
Right.
What I would like to say here, the healthy skin is not equivalent to fair skin. We have an obsession with fair skin, I feel, but that is not true. Dark skin is also healthy and beautiful.
Right.
So our obsession with fair skin has to go so that we do not misuse products, whatever the fairness products are there, because many of our Indians have this habit of using fairness creams, even steroid containing creams, which has caused a huge problem in the dermatological world, actually for us dermatologists also, with misuse of topical steroids on the face, causing topical steroid damaged face, and even an epidemic of fungal infections.
Right.
So my message to everyone is healthy skin is not equivalent to fair skin. It is a blemish-free, spotless skin. So that is what we should all aim for.
Right. Earlier, there were products, claiming to give you fair skin, but right now, I've seen a lot of products with brightening skin. So, what is the difference between those two?
Yeah. So, technically speaking, all creams which claim fairness have some component which will reduce the melanin. Okay.
Right.
But what everyone needs to understand, the natural constitutive color of the face, okay, of our skin is genetic. So that cannot be changed by any number of products, whether you take it orally or whether you take it topically. Okay, so what we can prevent is, of course, the overlying tanning which occurs, okay, which will cause darkening of the skin, so that we can prevent. But the normal constitutive color of the face, which we have genetically inherited, is not going to change with any amount of fairness creams or any oral products.
Right.
Yeah.
Okay. So my next question is, what are some non-negotiable practices when it's come to skincare?
Okay. As far as topical skincare is concerned, yes, cleanser is a major component of our skincare routine, apart from others which we may discuss later, like moisturizer, sunscreen, etc. But cleanser is something which is very basic. We live in a polluted environment.
Right.
Yeah. So at least a basic soap-free cleanser should be the part of everyone's skincare routine. Mm-hmm. And it can differ based on if there are any skin conditions, which can be, of course, recommended by the dermatologist, rather than self-assess and self-decide which product to use for your skin. Right. So for a normal person, of course, a normal soap-free cleanser is sufficient. And each person can decide on his own lifestyle, actually. If you are exposed more to polluted environment, you may need to increase the frequency of washing. But a simple use of cleanser, at least after coming back home, is a mandatory practice, according to me.
Right. So how many times a day would you recommend people using cleanser?
Yes, like I said before, a single, at least after coming back home, so that you get rid of the dirt on your face. So a simple soap-free cleanser is essential, at least once. In patients who are acne prone or have some other disorders, the frequency can accordingly reduce or increase. Right. For example, for an oily skin, you might require more number of cleansing episodes throughout the day. or a person who has atopic dermatitis, dry skin, may not require that much. And the
Right.
cleanser also may differ depending on the advice of the dermatologist.
Right. You said sunscreen and moisturizer comes later,
Yeah.
but a lot of dermats, recommend sunscreen very highly.
Yes, dermatologists will recommend sunscreens definitely, because depending upon the skin condition. For example, if the patient has some eruption which is going to be aggravated by sunlight, for example, melasma, so definitely sunscreen use is mandatory in those cases.
Okay.
So definitely a dermatologist will recommend a sunscreen, although Indian skins have a natural sun protection because of the presence of melanin, because we are slightly darker. So the distribution of the melanin definitely helps us in as a natural protectant against the sun. But we are also prone to tanning.
Right.
So that is the reason we do prescribe sunscreens, and not only sunlight, but the artificial light in our offices also cause damage to the skin.
Right.
So we do recommend sunscreens definitely, and definitely for those conditions which are aggravated by sunlight, definitely a sunscreen usage is recommended.
Right. So apart from tanning, what are the benefits of sunscreen?
Definitely, because sunlight over a period of time will definitely damage the skin, both the epidermis and the dermis, cause wrinkling as we grow older. So anyone who wants to prevent the sun damage definitely needs to use a sunscreen on a regular basis.
Right. So apart from good products, how big of an impact does healthy lifestyle has on skin?
Healthy lifestyle is actually a cornerstone for the management of healthy skin, actually, if you ask me. So starting from a good diet, which is rich in fruits and vegetables, so that we have an adequate quantity of vitamins and antioxidants in our diet. It's very important even to have a diet, a very balanced diet. So it is not just fruits and vegetables. It should not be a high carbohydrate diet like in the present lifestyle what we have. We tend to have a high carbohydrate diet. So this can also cause various skin conditions, apart from, of course, aggravating acne.
Right.
Yeah. So these are what we call as high glycemic foods, actually.
Okay.
So these are the foods which need to be avoided. So a good, healthy, balanced diet with adequate carbohydrates, adequate proteins, and vitamins and antioxidants is what is essential for healthy skin. Apart from that, our habits also, that is smoking, should definitely be avoided. It is one of the disastrous factors for damaged skin, actually, because that can accelerate aging.
Right.
So smoking is something which is to be totally avoided if you want a healthy skin.
Right.
Apart from that, of course, adequate hydration, which is essential for anyway good health otherwise also. So adequate hydration is also required. So a good diet, a good balanced diet and healthy habits is very, very important for
Right.
a healthy skin.
What about sleeping habits, stress,
Yes,
working
sleeping
out?
habits, stress also will increase antioxidants, etc., which will further cause damage of the skin. So like it is important for general health of the body, it is also important for the health of the skin also to have a good adequate sleep as well as hydration.
Right. Does expensive products, is there any difference between expensive products and, affordable products, I would
See,
say?
if you ask me, when we prescribe moisturizers to the patients, even simple whites of paraffin also works as a good emollient.
Okay.
So it does not always mean that an expensive product is always good. But having said that, there are special conditions for which you may prescribe certain special moisturizers.
Right.
But that is depending on the condition of the patient, where the qualified dermatologist would evaluate the patient and then
Right.
prescribe it accordingly.
Right. So my next question would be about consistency. So a lot of people have various tips in their skincare. I also struggle with consistency. My skincare routine is very simple, but still.
Yeah, so it is important to have a routine skincare regime which you can incorporate in your daily lifestyle. Okay, all of us have very hectic lifestyles. So even as dermatologists, we do understand if you are going to prescribe, we do tell the patient to apply sunscreen every 2 hours. But even I know that it may not be followed. But at least before going out in the sun, if they apply 10 minutes before, So at least that would help. So it is necessary to incorporate the regime into our natural processes of the day so that we do remain consistent. Otherwise, what is going to happen? The dermatologist prescribes it for 1 or 2 months, the patient may follow it, and then the regime goes out of gear. So it is necessary to incorporate in our natural lifestyle so that it becomes a regular part of our life.
Right. There's one question which I ask every single doctor who comes here is
What is the basic skincare routine that people can follow?
Okay. So like I mentioned before, cleansing of the skin is important, which will differ depending on the condition which the person has. Supposing he has acne, then definitely the dermatologist will recommend a certain regime for that
Right.
particular patient. Apart from that, moisturizers can be used as and when necessary, especially for those with dry skin. And the nature of the moisturizer can differ depending upon the extent of the dryness, and this also should be prescribed by a qualified dermatologist. Sunscreen usage, as I mentioned, routine sunscreen can be used to prevent tanning. So that is important. And the nature of the sunscreen can also differ based on the nature of the skin, whether it is oily, acne prone,
Right.
or the patient has got some photo aggravated dermatosis. Accordingly, the sunscreen may differ a bit. So that also should be prescribed by a qualified dermatologist. Apart from that, what we can do is for preventing aging, some dermatologists would prescribe a topical retinol containing cream. So, but that also has to be used on the prescription of a dermatologist. The concentration of the medication, how to use it, is best described by a dermatologist. So that can be used on the
Right.
advice of a dermatologist.
So that can be a skincare routine for people who are just starting, right?
Yeah.
What about people who have been following a skincare routine for a very long time? How long should one stick to one routine?
That again will depend on whether it is a normal skin, an acne prone skin.
Right.
So that again would differ on the basis of that. And as we age, maybe, retinol containing creams might become a more important part of the regime. It may not be for a younger individual.
Right.
So that can be decided by the dermatologist, whomsoever the patient is going to. So that can be changed accordingly. But a moisturizer, a sunscreen, a cleanser would remain part of normal regime right from the young age to the middle age to old age.
Right. Right. So Indians are very obsessed with glass skin. So what would you like to let them?
Yeah, that is a recent trend, that Korean glass skin which has come up. But again, I would like to emphasize that healthy skin is more important than achieving a glass skin. So what we should aim for is, if there is any skin disorder, get it treated so that it doesn't leave behind blemishes. Like for example, early treatment of acne, if you do, they don't leave behind blemishes, right? So
Right.
if you visit a qualified dermatologist, get your acne treated early, you're not going to have blemishes on the skin. It's a simple example actually.
Right.
So early treatment of skin disorders, routine skincare, routine healthy lifestyle in the form of a good diet, avoidance of smoking, avoidance of pollution, all these factors will help you achieve a healthy blemish free skin, which is what we should aim for rather than a glass skin.
Glass,
exactly.
right. But I feel a lot of people now associate healthy skin with glass skin.
No, it is not so. So like I said, a blemish free skin, a healthy skin with no
Right.
skin disorders is what is important.
Right. Okay.
Of course, there are procedures also available, which again a dermatologist would prescribe depending upon the nature of the skin, the
Right.
nature of the skin disorder which the patient has. So there is no one glove fits all kind of solution.
Right. So in our last episode, we actually were talking about acne in teenagers and adult acne basically. So before the podcast, we were talking when we were talking, you said you encourage healthy diet more. So of course, like there are a lot of hormonal acne, but how can a teenager and an adult make sure they have healthy diet?
Yeah, there is in this diet we have already discussed quite a bit. Another
Yes.
thing is the obsession with the gyms and the protein products. So that also needs to be taken care of because sometimes they contain hormones, it is possible, or whey proteins also sometimes can aggravate acne. So again, these should be very carefully handled. The obsession with the gym toned body, that
Right.
can cause repercussions on the skin with an acne prone skin. So these also need to be taken care of.
Right.
Yes, we are seeing acne early, probably because puberty is also setting in early nowadays. So we are seeing acne early. We are seeing what is called as adult acne. Normally, adolescent acne ideally doesn't go into adult acne, but we are seeing a lot of adult acne even in middle-aged females. Probably the lifestyle also plays a role with a high glycemic diet. So these also, and adult acne is often resistant to treatment. So they
Right.
are facing a problem with that. So the lifestyle plays an important role in all these factors.
Right. So when you were talking about gyms are usually unhygienic. So what are a few precautions people can take?
Hygiene, if you go to a good gym, I don't think hygiene is much of an issue. What is important is the supplements which are
Okay.
prescribed. So those should not contain hormones. Sometimes the whey protein containing supplements also can cause problems in some. Basically, excess of anything is a problem. So
Right.
that we need to understand. So hygiene may not be an issue because most of the good gyms will have good hygienic practices. So apart from the excessive sweating which might occur and can aggravate certain conditions, I don't think hygiene would be much of an issue in the gyms.
So surprisingly, we are actually on our last question already. So what is one advice you would like to give to our listeners?
What I would like to say is many of Indian patients have the habit of taking over-the-counter medication, something which has been prescribed to their cousin, something which has been prescribed to their neighbor. That should not be done.
Right.
Right? So they should visit a qualified dermatologist to set up that normal skincare routine or whenever they have skin conditions so that the right medication is prescribed. Okay. Because we have seen over the years the topical steroid menace which has come up. Ideally, it should not be used without the advice of a dermatologist, but there are many patients who use it on the advice of their relatives, on the advice of the chemist, and this has resulted in a full-blown fungal epidemic in our country.
Right.
Yeah. So people come with steroid damaged face, extensive fungal infection because of the misuse of this medication. This is all because they do not visit a qualified dermatologist and tend to listen to the advice of a neighbor, a relative, or even the chemist who are not qualified to give you the medication.
Right.
So that is one message I would like to give, that visit a qualified dermatologist, set up your skincare routine and then follow it. If you have a skin condition, again visit a qualified dermatologist and take appropriate treatment rather than avoiding it and messing up our face by applying topical steroids.
Right. That's all we had for today's episode. If you have any questions about skincare or healthy lifestyle, make sure to leave them in the comment below. And don't forget to like, share and subscribe.